question is this: all of the following are risk factors for the development of malignant melanoma except. So you need to identify which one is not the risk factor. So if you have answered it as Kapha spots, then your answer is right. Why? Because Dysplastic Nevus, family history of malignant melanoma, family or personal history of malignant melanoma, and Freckles, all of these are risk factors for development of malignant melanoma in a particular individual platform. Okay, so this is from textbook of Bologna Dermatology. So here you can see there are few genetic, environmental and host factors which are going to act as risk factors for malignant melanoma, and among which you can see family history are the ones which I am going to highlight are the important ones to be remembered. Family history, tendency to burn, that is sunburns, and inability to tan, these are important risk factors. And also of course xeroderma pigmentosum, as you all know, this is also one more risk factor. And here you can see chronic sun exposure or intense intermittent sun exposure is one other risk factor. And I want you to focus on this point: melanocytic nevi and solar lentigines. So these are also risk factors. So this is from Harrison's textbook 20th edition. Here you can see the strongest risk factors for the melanoma are presence of multiple benign or atypical nevi and family or personal history of melanoma. Okay, and I just want you to also notice the presence of more than 40 melanocytic nevi, common or dysplastic. So dysplastic nevi is a risk factor for malignant melanoma, and nevi have been referred to as precursor lesion because they can transform into melanomas. Nevi are referred to as precursor lesion because they can transform into melanomas. Individuals with clinically atypical moles, that is, you need to clinically examine them and find out A, B, C, D, E. We'll discuss this in separate video. And a strong family history of melanoma have been reported to have more than 50% lifetime risk for development of the melanoma, and they warrant close follow-up with the dermatologist. So few points about this macules or cephalospot. These are absolutely benign birthmarks which are seen absolutely normal in a few individuals, and also they are associated with a few genodermatosis. You can say remember the most important one, neurofibromatosis, and also probably one more entity, McCune-Albright syndrome, about which you will read in your gynecology and also in your orthopedics. We will discuss about this macules in a separate video most probably. Okay, so that's it in this small video. So if you do like this type of short video explanations, do subscribe to me.